there is already thyroid storm. So definitely patients here will really experience your increased body temperature. At the same time, there is what we call your severe and uncontrolled hypertension of your respective patients. And even neurological signs and symptoms may also experience into your patient, specifically restlessness, anxiety, irritability. Your patient is very agitated. So that's one of the signs and symptoms in relation of your thyroid storm, in relation on the concept of your thyroid storm. Okay, so uh, that's why, if possible, we need to prevent your thyroid storm. It's because, right, once the patient is maintaining the level of your thyroid hormone, that's the time that the patient will really need the removal of your thyroid gland, which is your thyroidectomy. Now, right after your thyroidectomy, this would be our nursing interventions, okay? We will assess the vocal production or the voice production of your patient. Is because your thyroid gland is just only very adjacent to the larynx. So there may be a possibility here that during the surgical procedure, there is a trauma or there is a trauma or an injury into the larynx that may affect the vocal production of your patients. At the same time, right after the surgical procedures, we also need to assess any signs and symptoms of the bleeding. So definitely, okay, so definitely once we will assess the bleeding itself, we will not assess the incision site or the anterior portion of the neck of our patient, but rather than we will assess the posterior portion of the neck of our patient. Why is it? It's because of the gravity. Okay, the gravity in such a way that the blood itself or the bleeding itself will really pulls down and will go to the posterior portion of the neck of our patient. Okay, so often we tend to see the anterior or the incision site, but unfortunately, it's yes, it's true that it's very lesser. But once we see the posterior portion of the neck, there we could see already a lot of blood. So that may happen, or that may be happen once the patient who has bleeding in relation to the thyroidectomy itself. Okay. So other than that one, your hyperthyroidism patients will also experience what we call your exophthalmos, kanang ning burot o nibudlat ang mata sa pasyente, and your goiter, kanang ning dako ang liog sa pasyente. But mind you guys, goiter is not an indication. Yeah, goiter is not an indication that goiter is really related to your hyperthyroidism. Okay? Your goiter there could also be happening to your patient who has your hypothyroidism. Okay? So that's why if patient is very doubtful if that goiter has something to do with hypo and hyperthyroidism, then patient is really in need to undergo some form of diagnostic procedures, specifically your T3 and your T4 examinations, or if not, your radioactive iodine uptake examinations. Okay, and since we're talking here about goiter, actually there are natures of what goiter is. Goiter could either be non-toxic, at the same time goiter could also be toxic. Now, every time we talk about toxic goiter, okay, every time we talk about toxic goiter, actually this is really associated with some kind of cancer of a thyroid gland. So that's why if patient is really need, or if patient is found out that goiter is toxic, then that's cancerous, then patient may or will or is necessary to undergo some form of chemotherapy or radiation therapy at all. And again, to determine if it is toxic or non-toxic, then biopsy is the confirmatory diagnostic procedure on it. Okay, and what else do I need to raise or share? Oh, yes, hyperthyroidism. One last thing. On your hyperthyroidism, one of possible causes of your hyperthyroidism is what we call your Graves' diseases. Okay? So your Graves' disease here is a medical condition or another medical condition that would trigger the excess productions of your thyroid hormones, specifically your T3 and your T4. Okay? Do not be confused there. It's because there are other books that there are other books mentioning that other name of your hyperthyroidism is Graves' disease. No, actually it's not. But rather than that concept of your Graves' disease here is the possible causes or one of the risk factors leading to the medical conditions of your hyperthyroidism. Okay. Wait. Okay. So let's proceed. Let's have here on your hypoparathyroidism and hypoparathyroidism, and we also have here your hyperparathyroidism. Accept. Okay, so on your hypoparathyroidism, your hypoparathyroidism, there is hyposecretions of your parathyroid hormones. Usually, your hypoparathyroidisms will also happen once the patients will undergo your thyroidectomy. So patients who has this kind of medical conditions will experience your hypocalcemia or any signs and symptoms in relation to your hypocalcemia. So those are your chivosic, those are your transsucine, and we also have there the signs and symptoms of your tetanus, specifically on your opes totonus itself. And interventions for your hypoparathyroidism here is that calcium supplementations is possible. At the same time, vitamin D supplementations or any exposure for your vitamin D in order to promote some form of calcium absorption. But again, a sort of reminder, once the patient or the person is taking your calcium supplementations, it should be daytime, it should be associated with any kind of activities or any exercises for promotion and for faster absorptions into the bones and even into the teeth. Why? It's because we are preventing here any formations of your stones, either your gallstones or if not, your renal stones itself. And let's have here on your hyperparathyroidism. So there is hypersecretions of your parathyroid hormones by your parathyroid gland. So hypercalcemia na naman. So on your hypercalcemia, so your definitely there would be bone deformities, okay, or abnormality structure or abnormality formations of the bones, or if not, formation of the stones. And then there is also your hypophosphatemia. So interventions for your hyperparathyroidism here is diuretics, your Lasix or your furosemide will also be given. Why? It's because as much as possible, we will excrete too much calcium within the body. And what else? Yes, proper monitoring of the bone density of your patient. It's because too much calcium will also lead to fragility. Too much will also lead to fragile of the bone, leading to the high risk of bone fractures. Okay. And let's have on your diabetes mellitus. So for your diabetes mellitus, actually, this has something to do with the hormones of your insulin. So let's trace it again. Pancreas produces hormones. Hormones, those are your insulin and glucagon. Insulin plays the most important role. It's because it's responsible for your blood glucose monitoring. And without the insulin, so that's why patient is in need of your insulin therapy. It's because that's where our diabetes mellitus exists or will appear. Now this time on your diabetes mellitus, there are really two kinds, or there are two kinds of your diabetes mellitus here. First is we have here your type 1 diabetes mellitus. Second is we also have there your type 2 diabetes mellitus. So what's the difference? Type 1 diabetes, it's more on your insulin dependency. So usually type 1 is very common for children. While your type 2 is very common for obese, it's because what is happening there, there is an insulin, but unfortunately insulin there are not properly used in order to to maximize the level of glucose within the bloodstream. So yes, to maximize the level of the glucose within the bloodstream. So that's your diabetes mellitus type 2. So on your diabetes mellitus, wait, okay. Okay. So on your diabetes mellitus, uh, actually, we need glucose for our body in order to perform its functions. Okay. So that glucose will undergo the process of what we call your glycogenesis. It's because once the glucose will undergo the process of your glycogenesis, that glucose will be formed into your glucagon. So that glucagon itself, okay, that glucagon itself is no longer a sugar, but rather than that glucagon is another chemicals or a materials or a substances within our body that would already aid in helping the insulin in monitoring the blood glucose. Okay, so that's why, as what I said earlier, if you remember insulin and glucagon, glucagon is not that as important as it is compared to insulin. It's because insulin really plays the most important role with regards about glucose or in terms about diabetes mellitus. So if and only if in the concept of your diabetes, either type 1 or type 2, in the concept of that one, insulin will never, no, not insulin, sugar, sorry, your glucose there, okay, your glucose there will undergo the process of your glycogenesis. But unfortunately, some, or let us just say majority of the volume of the glucose will within the bloodstream will not undergo the process of glycogenesis and will not undergo or will not be converted into glucagon. So definitely they will still be remain they will still remain to its original property, which is glucose. So if that glucose will still be glucose and that glucose is traveling within our blood vessels everywhere within our human body, so definitely that could also be harm to the different vital organs of our body. So that's why with the help of your insulin, insulin is there, okay? With the help of your insulin, insulin is there in order to catch up those glucose or to capture those glucose and tell those glucose to undergo or to went the process of your glycogenesis in order to be fully converted into the glucagon. So that is why if there is a fully conversion from glucose or from sugar to glucagon, then it has no harm on it. So definitely no diabetes mellitus may happen once there is a complete conversion. But if and only if there is not a complete conversion, then that is the time that diabetes mellitus may happen. So again, there are two kinds of them, your type 1 and your type 2. Type 1 diabetes is insulin dependency. So definitely, yes, this is very common for children. So on this kind of scenario, we can tell if it is type 1, we can tell if it is type 2 as to when the diabetes mellitus exists. Okay? Actually, there is no definite diagnostic procedure to really determine if that is type 1 and type 2. It's because remember, we only have your fasting blood sugar and your glucose tolerance test. Okay? So once we found out that there is an excess of your level of the blood sugar. So it's just only limited to the concept of your diabetes mellitus. Now this time, what kind of diabetes, what the question here is that what kind of diabetes mellitus that we are having or that the person is having? Is it type 1 or type 2? So in order to answer that questions, again, labeling type 1, labeling type 2 will only differ as to when the person is diagnosed to diabetes mellitus. That's a period. Okay? So if that person who is considered to be a child or a children, then he is or she is having a diabetes mellitus, then that is your type 1. So expectedly, your patient there or that child there or that children's there is really need to undergo your insulin therapy. But insulin therapy will also be matter is because again, it will depend on the examinations or on the results of your fasting blood sugar or your glucose tolerance testing. Okay? While your type 2, okay, if the patient is old enough or elderly people and then it was found out na nasa diabetes mellitus, then that is type 2. So for that concept, patient is no longer in need of your insulin therapy, but rather than it's more on the diet modification or any kind of lifestyle modifications. It could be on the diet or it could be in a form of exercise, or if not, it could also be in a form of medications. Usually medications for elderly people will be given your metformin. Your metformin is one way to decrease the level of the glucose within the bloodstream of your respective patients. Did you get my point? Anyone? Students? Hello? Are we good? Hello?
Yes, sir.
Okay. So actually, as to signs and symptoms, they only have the same signs and symptoms katong 3 P's, your polyuria, your polyphagia. We also have your polydipsia. At the same time, diabetes mellitus patient, either type 1 and type 2, should pre- uh, should uh, should wear an identification tag. It could be bracelet or necklace that indicating that he or she is having diabetes. It's because there may be times or there may be a certain situations that your patients will experience fainting or any loss of consciousness. It's because of your hypoglycemia. So on the side of your patients are highly encouraged to bring some form of candies or juices to counteract your hypoglycemia. Okay? Or if not, patients with diabetes mellitus is also high risk of your seizure. So that's why medic bracelet or any necklace is a good interventions to determine that this patient or would really identify that this patient is diabetes mellitus. Okay, so what else? Oh, yes. Once the patient is undergoing some form of insulin therapy, okay, so definitely your insulin therapy will be given through your subcutaneous route, or if not into the fatty tissue deposits or fatty deposits. Okay, so commonly it should be within our stomach, okay, or even in the buttocks area, or even in the vastus lateralis. But it's very common in the stomach or within the abdominal cavity. Okay, so once you've injected your insulin therapy, so on the next day, you could not use that site, but you are going to measure 1 inch from that injected site. So 1 inch from that one, you can use that one. Okay, and then on the next day, on the third day, you are going to measure that one, another 1 inch from that another injection site. So, and then once you measure or once you have the result, then you can use that one again. Okay? Dili kay karon you use that site, the same site, and then on the next day, the same injected site. No. Okay? What we are preventing here is the presence of your lipodystrophy. What does it mean? Lipodystrophy, it means distraction of the muscles or distractions of the injected sites. Okay? Usually, in layman's term, kanang lipodystrophy, mangyat-yat, manghupyak, sana lupyak o manglupyak ang kanang injected sites. Okay? So if and only if wala nagjug kay ma-injectan sa imong abdominal cavity kay nahurot na og measure og mga 1 inch nimo, actually you can go back to the original injected sites. Okay? But make sure that it should have 1 month duration again in order to prevent your lipodystrophy. Okay? Are we all good?
Yes, sir.
Questions?
Yes, sir.
Sige. Let's proceed. Let's have on your DKA your diabetic ketoacidosis. And we also have here your HHNS. uh, what is that? So actually on your diabetic ketoacidosis, this is already the chronic form or a worst situations for patients who has your type 1 diabetes mellitus. So usually children will suffer here or will suffer the consequences of your DKA. It's because again, type 1 diabetes mellitus is very common for children or for a child. So with a prevention of that one is that insulin therapy is really in need for a patient. So ketoacidosis, it means that there are already ketones. Okay, ketones came from the glucose. Okay, so once the glucose will not be properly converted into glucagon, so that glucose will turn into ketones. So that ketones are very acidic in nature. So normally, once there are already ketones, side effects are all vasoconstriction. All blood vessels will be vasoconstricted. So delikado makoma atong pasyente, it's because of the decreased blood flow circulation or decreased oxygen supply into the neurological system. Okay? While your HHNKS or your hyperglycemic hyperosmolar non-ketotic syndrome, this is for type 2 diabetes mellitus in such a way that excess of high sugar, okay, excess of sugar within the body. So hyperglycemia ang atong pasyente. So mag-hyperglycemia ang atong pasyente, so taas gyapon siya sugar, pero ang nakaapan lang ana niya is that your hyperglycemic hyperosmolar non-ketotic syndrome can be treated with the use of medications. Okay? At the same time, lifestyle modifications could also be an intervention for this kind of medical conditions. Actually, your DKA and your HHNKS is very rare once the patient will really undergo an early treatment or early intervention once they diagnose either type 1 or your type 2 diabetes mellitus. Okay? So, any questions? Anyone? Hello? Are we all good? Pangutana, before we end or before we dismiss. Anyway.
None, sir.
None so far. Sige. Okay, so sige. So before we end, I would like to remind everybody again, okay, kabalo ko na po anakod mo, permit for the Black 2, and then next week, right after our RBE, manawag na po ko for our SSP. Okay? And then, sa paman. And feedbacking of your P2 grades will be happening during nasa block 3 sa atong SSP. Ato na lang i-insert sa SSP na to. Okay? So, I hope you understood everything or understand everything on what I share it to you. So, let's final end this one. So, tomorrow we will not discuss. We will not use our time tomorrow. So, let's have it a study break or a study day and preparations for your P2 exams. Okay? And then, what else? So, pa may concerns before we end? Wala na. Okay. So no questions so far. So that would be all. Class dismissed. And guys, thank you so much. Signing off, everyone. Bye-bye.
Thank you, sir.
Bye,
Thank
sir.
you, sir.
Thank you,
Goodbye.
sir.